Put your hands by your side now. Chow some. Action.
Doctor.
Keep quiet. Keep quiet. Good morning, children.
Good morning.
Okay, if you see someone dressed like this, who do you think the person is?
Doctor.
Doctor, great. So who do you think a doctor is? Who is a doctor? Good. So
The doctor is the person who treats patients.
that is great. So I am a medical doctor. I treat patients. So if people are not feeling well, they come to me and I'll just write 1 or 2 drops. First, I examine them with my stethoscope. What I call this? Stethoscope. So we'll just use it to listen to their heartbeats and to their breath sounds. And you know the heartbeat goes boom, 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 boom. Have you?
Yes.
Good. And the breath sounds goes. You understand? So we use this to listen to that. You understand? So other things that doctors do, they check patients from head to toe. We check the head, if there's anything wrong with the head, if the eyes are okay, if the eyes are clear. You check the nose, you check the mouth, you check the chest, you check the tummy, the legs, the hands, and be sure that the person is well. Then after which, if the person is not feeling too well in any of those parts you've checked, you will now write drugs. And what do you think drugs do when people use them? Great. She said that the drugs that I would prescribe will be the drugs that will make the person feel well. And that is it. So that is it. So when you come to the hospital, most people when they come to the hospital, they're always thinking of injections. It's not every time that we give injections. It is only when the sickness is very serious. You understand? But most times we give medicine and we counsel. That is talk to the person on how to live a healthy life. So that is basically what doctors do. So I want to know, how many people want to become doctors later? I've already had so many disciples. That is very good. So to become a doctor, you have to read very hard. You have to read very well, read your sciences, because doctors are scientists. So you have to read your sciences very well. Do you understand? Okay, so does anyone have any questions for me? Sit down and stick.
What is your name?
I'm Dr. Mrs. Ajayi. Any other person? Yes, thank you very much for that question. The challenges that doctors go through. Sometimes when patients come, especially children, young children, they are a little difficult to examine. For instance, once I get to the hospital and small children see me dressed in white, the first thing they think about is the injection. So they are very, very difficult. You have to first calm them down. They won't give you injection. Let me first know what is wrong with you. Some of them will run, the parents will chase them, and they will bring them back, scratching, screaming, and all that. And you now have to calm them down. So that is one of the challenges. Another challenge is that when you even write the treatment for the patient, they will not want to use it. It's not every patient that likes using drugs, you know. Even sometimes the little ones too in the house do not want to use drugs. So that's another challenge. So by the time they don't use their drug, they don't get well and they will come back again. You understand? Then there are some times that some of the illnesses are things that you will have to take your time to go through it in your brain. That okay, this sickness has been a long time since I've seen it. Let me go through it in my brain and now come back and take the person on it again and see that, okay, yes, I can actually do this thing and treat this patient. Do you understand? All right. So any other questions? All right. I believe I have convinced and not confused you. So, okay. Yes.
What are the other apparatus that doctors speak out?
Okay, good. The other apparatus, there are quite a lot. There's, when someone comes with a very hot body, which we call a fever, there is something we use to check. They call it a thermometer. What do I call it?
Thermometer.
Okay, all right, I didn't bring it today. So it's just a small thing. You put it under the person's armpit. You know it? Good. You put it, okay, all right, something like this. You put it under the armpit and wait for about 2 minutes, 2 to 3 minutes. After which you will now read it here. And once you see it, you will just be like, okay, this person has this temperature. So this person maybe has malaria and we have to treat for that. So that is it. Okay, so that's even good. We even have, so I've introduced the stethoscope to you. Then this is a face mask. As you can see, this face mask, it is used mainly when there is maybe an operation that you want to do. Doctors also carry out operations, so you have to use it to cover your mouth so that when you open the parts of the body of that patient, you don't put in germs into the patient, so you cover your mouth. Or if a patient has a serious cough, sometimes you will use it to cover your mouth so that you yourself will not get infected. So I think we have other things here. Okay, yeah, this is like a first aid box, of which we should all have, at least I know you have one in the school. So that, and it will contain things like little bandages, plasters, in case someone gets wounded. It also has little drugs like paracetamol in case there is a hot temperature, or a fever, or a headache. You have little drugs here, bandage in case of you hitting your leg somewhere. Then we have other things. You can have this. You have, okay, this is an injection. Yeah, a very funny one. This is an injection which, as I said, if the sickness is very serious, that is when we use injections. There are other ones too that we use to check blood pressure. We also have some for checking weight, your weighing scale too. Doctors use weighing scale because if you want to write drugs, you want to know the weight of that person, especially if it's a child, so that you will not give the person overdose. Do you understand? So that's just a few of our drugs, our apparatus that we use. Any other questions? All right. So once again, let me know how many people want to become doctors. Yay! Yay! So those that want to become doctors, clap for yourselves. Thank you very much. Thank you very much. Put your hands together for everybody. Thank you, ma'am. Mr. Dr. Come back.
Hello, children.
Hello, ma'am.
Good. This week is our careers week, and that is why we have Dr. Ajayi here this morning to give us a talk on how to become a doctor and tell us the apparatus that the doctor use. Is that clear? And I hope you've learned one or two things from our talk this morning. Is that right? Now let's put our hands together for her again. Now we have a birthday boy in our midst this morning.